Hey everybody, welcome to the Tele Town Hall meeting with Congresswoman Mary Jo Kilroy from Central Ohio. I'm Paul. I'll be serving as your host today. For those of you that have been with us before, welcome again. For those of you that haven't been with us, I just want to go over a couple things just so it can be a really good town hall and you can all interact with the Congresswoman in some way. There's a couple of things we'll do as we start the call. And one of the things that we want is that if you want to ask the Congresswoman a question, it's pretty simple. All you have to do on your phone is press *3, and you will be able to go talk to one of our staff members who's here to help you. They'll ask your questions so that we can make sure everyone is asked in order and that we're not asking the same question, a bunch of times. And then you will actually be able to ask the Congresswoman your question. Again, all you'll have to do is press *3. You'll be entered into a separate chat room with our staffer. Once you're done letting them know your question and your name, you will be put right back on our call, and you'll get a chance to ask the Congresswoman a question. And I'll prompt you and say, hey, we're waiting for you, caller from the 15th District, to ask the Congresswoman a question. So I think the Congresswoman is on the line with us now, and probably would want to say a few opening things to those of you just joining us.
Well, hello, everybody, and I want to thank everybody for joining us on this telephone town hall. I have enjoyed meeting with people throughout the district around the issue of health care. We started doing these meetings somewhere back in February, a number of roundtables, some with doctors, some with nurses. We've done community meetings from everywhere from Clintonville to Plain City, met with seniors in Grove City, and also have used my website to engage in some dialogue and understand your questions and concerns around health care. And what I've seen on the website and the stories that people have written in about their own health care situations gives me some of the most compelling reasons to work hard so that we can end up with a new health care system in this country that will make it affordable and accessible to all Americans, that will lower our costs, that will continue to give us choice, that will inject competition, keeping the private sector but adding a public sector choice, to give us a choice of doctors and plans, and put an emphasis on wellness and prevention. Some of the stories have really been heart-wrenching and show the high stakes that a lot of us, our neighbors and friends, our children, all kinds of people around the district are feeling because of this crisis in the healthcare system. I heard from one physician, a cardiologist in Columbus, and he writes that I see the damage done every day to patients from the current system. One recent example was of a young man who lost his job and therefore lost his health insurance and could no longer afford his medications. Because he could not afford a $100 a month medication, he ended up in the hospital with a clotted coronary stent, which led to a heart attack, led to a $50,000 hospital bill. And he's not going to be able to pay that bill, but somebody will have to. Our current system, the doctor writes, does not make any sense. We need to inject honest competition from a strong public option with private insurance. And according to the doctor, his quote there, honest competition from a strong public option with private insurance would seem a reasonable step to bring affordable coverage to people. So please help fix our broken healthcare system by voting for reform. Another woman writes about the battles her mother had with breast cancer, a diagnosis she received about 5 years ago. She battled it for 3 years with several different kinds of chemo treatments. They worked for a while, but then, as sometimes happens with chemo, they stop working. The cancer figures out a way around them. Her mother's doctor had another drug that he wanted her mother to use, but Blue Cross Blue Shield denied it, saying it was, quote-unquote, experimental. They petitioned, but during the time that petition was pending, her mother passed away. And Tammy writes, I do not believe that any insurance company should ever have the right to deny medical care or pick which medication a patient should have, because the insurance company does not have the medical credentials or degree to decide the best medical care. that is why the doctor went through years of schooling. So I'm looking forward to hearing from your questions, to engaging in this dialogue. I want to find out your concerns, and I hope that we are going to be able to give you some very important information about health care reform in this country.
Thanks, Congresswoman. As the Congresswoman said, we look forward to talking with you tonight and making sure that you get all your questions answered. Again, if you just joined us, and we have actually, Congresswoman, over 1,500 people on the phone right now.
That's terrific.
I think that's our record for our town hall so far. I'm sure we'll continue to grow as people get on the line. We have about 12 people waiting to ask questions. We have 3 great staffers with us tonight who are going through and taking your questions. So hang in there, be a little patient, kind of like a talk radio show, and we'll make sure that we get your question up on the screen. But Congresswoman, I don't know if you want to go right away to the. Excuse me. Let me make sure again. Those of you that are just joining us, if you want to ask the Congresswoman a question, you need to hit *3 on your telephone keypad. That's *3, and you'll be entered into a room where you'll be able to talk directly to one of our staffers who will get your question. Make sure it gets up on my screen, and we'll make sure that we ask them and get things ready. So, Congresswoman, the first caller that we're going to go to live is I think it's Glenna Clayton. And Glenna, do you have a question for the Congresswoman?
Yes.
Glenna, we're with you. Go ahead and ask your question.
Hello, Glenna.
Oh, okay, hi. I am not for socialized medicine, and I do not understand all of this mess that they've got. The one that they've got set up with all these 1,000 and some pages and everything. Everything is so complex. Can't they find something that is easy to understand for us older folks?
Well, I hope tonight during this call we can break it down so that all of us can understand what this is about. This is not about socialized medicine. This is about making sure that all of us have health insurance that we can afford, to make sure that all of us have health insurance, and that we help to put an emphasis on prevention and wellness. But most importantly, and this is why I'm saying this is not socialized medicine, doctors and patients are going to stay in control of their own care. It is going to get the insurance bureaucrat out of the room with them, and we're going to keep the government bureaucrat out of the room with them. What we're going to do is to provide a system of insurance, a public insurance option side by side with private insurance options for those who don't qualify for Medicare or Medicaid, so that we can lower the cost for all Americans. But this is about giving Americans control and choice, and to make sure that they and their doctors are in a good position to make decisions together about their health care.
Great. Thank you, Congresswoman. I think we lost the caller, but she answered it correctly. Again, those of you that are just joining our call, we're now, Congresswoman, we're over 2,000. We're actually at 22 people from throughout the district that have joined us, so obviously a very good topic, and everyone's very excited. Again, those of you that just joined us, if you want to ask a question, please hit *3 on your telephone, and you'll be entered into a separate room, a separate telephone conversation with those staffers that are with us that are going to take your call. Make sure you get your question asked, hopefully, and we'll be able to move through that.
Let's go to another question.
Sure. Let's go to another question. We're going to go to let's see, Catherine Augenstein, I think is the caller's name. Catherine, are you with us?
Yes, I am.
Great. Catherine, why don't you ask your question to the Congresswoman?
Okay. Why does the American people have to pay for abortions out of taxpayer money? Don't you realize these unborn children are what pays for Social Security and Medicare for the next generation?
Thanks for your question. You may recall that the Hyde Amendment was passed by Congress a number of years ago. It's still in effect. And the Hyde Amendment forbids federal tax dollars from being used to pay for abortion. So I know a lot of people have raised concerns about that, but it is not in this bill. There's no change in the Hyde Amendment in this bill, and abortions cannot be paid with taxpayer dollars.
Great. Thank you for your call, Catherine. Congresswoman, we're going to go to, hold on one second. I got to get it on my screen here. I just want to make sure we don't lose it. Here it is. Mary, Mary, are you with us? You want to ask the Congresswoman a question?
Yes, I do. There's already a shortage of primary care doctors in the country. In fact, there's now an area of Ohio that doesn't have a single one. What is going to be done to encourage more doctors to go into primary care so that when you add a large number of patients to the system, so that they don't have to go to the emergency room for treatment of minor things because they can't get in with a doctor?
You are right that it's so important to keep people from treating their primary care illnesses in the emergency room. And we want to encourage people to use a primary care doctor to have a health care home. So what we're doing is, number one, encouraging doctors to choose that as their profession by giving loans and grants to students who want to practice primary care medicine. So we want those good medical students to make primary care a choice. And a lot of doctors tell me that's the kind of medicine they would really like to practice, but they get out of school with such big loans that they feel they have to specialize. So this will very much help increase the number of doctors choosing primary care. Secondly, we're going to help encourage that by making the Medicare payments more fair. Right now, Medicare payments and Medicaid payments for primary care aren't as financially, they don't help the doctors out as much financially as if you specialize. If you order a test, you get paid more. If you do an operation, you get paid more. But we don't pay for the primary care work of taking that history and counseling that patient about how to quit smoking or how to control their diabetes, any number of things. So we want to make sure that doctors get paid for their time as primary care practitioners doing the things that we need them to do. Finally, lack of doctors in rural areas is a real problem in this country. And we've had several discussions in Congress about that issue, and this bill will help even that out to make sure that the rural areas get support for physicians to locate offices in those communities and help rural America have the kind of health care that they need.
Great. Thank you, Congresswoman. Again, if those of you just joining us, and now, Congresswoman, we have almost 2,500 people on the call at this time. If you are just joining us and want to ask the Congresswoman a question, please press *3, and that'll get you to our staffers who would be able to get your question answered. Congresswoman, we're going to go to a question right now from, let me just get where it is, Suzanne Hanno, and after that we're going to actually ask a poll. So, Suzanne, are you with us?
Yes.
Great, Susan, why don't you ask the Congresswoman the question?
I can't understand why people don't want to go to the public option. I think that apparently they think that that their medical insurance people are going to cancel them, and then they're going to have to go to the public option. And I don't understand why they feel that way. They're worried about it.
Well, if you have insurance right now, you shouldn't worry about a public option. If you have insurance now, you should be able to keep that insurance. And if anything, you should be more secure in keeping your insurance because insurance companies can no longer engage in this practice called rescission if this bill passes, where they cancel a whole group of insurance because people start using it or making claims. We make sure that people won't engage in insurance companies won't engage in discrimination based on pre-existing conditions, and your insurance will be strengthened because it will eliminate lifetime caps. Some people go through their insurance and find out at the end of the day that the insurance they thought was good wasn't good enough to cover the high health care bills that they were experiencing. It can reduce their premiums and lower their cost, and I think that's going to be very important, that a public option in competition with private insurance can reduce costs for all of us and eliminate that kind of cost-shifting game that insurance companies can engage in. We want to make sure that at the end of the day that we are going to be lowering the cost of health care for all of us, insured and uninsured. There's a lot of benefits for the insured population in that. The public option will be there as an option on a marketplace, competing next door to private plans. It will only be available in the initial years to people who don't have insurance or who work for very small businesses. And so most people are going to stay exactly where they are in their employer's private plan. Nothing to be afraid of there.
Great. Thank you, Congresswoman. We're going to go to a question in 1 second. We will go to a question from Matt. He's got a question about funding for the plan and where the fundings come from. But first, I want to do a poll. The polls are pretty interesting. We've picked 3 questions for tonight. We'll ask them once about every 15 minutes, and we'll make sure to get you the results at the end of the night. The first question poll is, what level of reform do you believe is necessary for health care in this country? If you believe that health care needs to be completely transformed, including an alternative to private insurance like the public option, press 1 now. If you think the healthcare needs insurance reform only, just like eliminating things like pre-existing conditions, like the Congresswoman spoke about, press 2. If you think healthcare needs to limit the amount of government regulation totally, even if it means that some Americans will lose their healthcare, you can press 3. And if you think the healthcare system is completely fine the way it is, you can press 4 now. 1, 2, 3, 4, and give us your thoughts on that, and we'll be able to get those results to you at the end of the night. And now we're going to go to Matt, and Matt has a question about the funding for the plan. Matt, are you with us?
Yes, I am.
Go ahead, Matt.
My question is, there apparently exists some concern all around about funding for this program. You mentioned earlier that there was, in fact, we indirectly pay for the cost of medical care for someone who can't pay for that. But essentially, this plan is just distributing that in a different way, and we still do pay for it. So what we can't pay for, where is the additional funding for this program coming from?
Let me see if I understand what you're saying here. In terms of the cost shifting, you're right, because there's a lot of money out there in the system now. We're paying trillions of dollars for health care expenses. When we think about what all of us, private plans and the public plans, Medicare, the Veterans Administration, et cetera, are putting into the health care system. And we're also paying for the uninsured. Uninsured, as with the first story that I talked about, with the gentleman who couldn't afford health care, ended up with a serious heart attack with a $50,000 bill, we pay that. We pay that either with higher insurance premiums, or we pay that one way or another through our taxes. So there is a lot of money that we are paying for a system that is inefficient in that it leaves a lot of people out of the system altogether. So we're going to pay for this for a variety of mechanisms. Number one, there is going to be a surcharge on higher income earners. Now, there's been various numbers thrown out there. Some say those with incomes over $1 million, and there's been different percentages thrown out there. We are going to address this also by cutting costs in the system. We hope to address it by cutting the costs of prescription drugs, for example, getting a better deal for the public from the drug pharmaceutical companies. Also, being able to do that by addressing some of the payment issues with Medicare, Medicaid, and others that need to be addressed, where we have privatized some of it, and we're frankly paying too much money to the private insurers from Medicare and Medicaid. So it's a combination of taxes or surcharge on the top 1 or 2% of the earners in this country, and also cutting costs. If we don't do this, one of the things that we're going to experience is that the status quo isn't going to stay the same. It hasn't stayed the same. Every year, the insurance cost to employers and others goes up higher. It goes up by double digits every year, and it will continue to do that. And their estimates said it will very soon cost the average employer $21,000 a family to insure a year. That's a lot of money. And also, we're going to be addressing this, continuing to address this over a period of years so that we can continue to get more costs out of the system, make it more equitable, and make sure that we are paying as we go and not adding to the deficit.
Great. Thank you, Congresswoman. We're going to go to a question from Georgia in a second about tort reform, but I just want to give folks the results of our polling question. 45% of the folks on the call, and now there are 2,800 people on the call, Congresswoman, think that healthcare needs to be completely transformed, including that choice for a public option. 21% thinks that healthcare needs insurance reform only, like eliminating pre-existing conditions. 20% of the people think that healthcare needs to limit the amount of regulation by government, even if it means that some will lose their healthcare. And 14% believe the system is fine where it is. So we can get a lot of questions in. Our staffers are just asking that you have your question ready and just ask your questions so that they can get into the system very quickly and we can get to as many of these questions as possible. Next we'll go to Georgia, who has a question about tort reform. Georgia, are you with us?
Yes, I am. Thank you.
Great.
I was interested because one of my doctors actually lost many of his partners because the price of malpractice insurance went so high they couldn't afford it. And it seems like the cost of the malpractice suits that we see is just out of sight sometimes. And that might play into the whole insurance coverage piece. So where do you think the tort reform fits into the whole plan?
Well, it's interesting that I'm sorry to hear that your doctor went out of business because of the high cost of his malpractice premiums or her malpractice premiums. Because, Ohio legislature passed tort reform, and one of the things that they hoped to get out of that was that doctors would get lower premiums. Yet we find out that hasn't really happened. And it hasn't helped us lower our health insurance costs in Ohio either. Ohio, like everywhere else, is seeing rising costs of health insurance premiums. Tort reform is typically a matter for state legislatures, and many state legislatures around the country, places like Texas, Illinois, Ohio, already have tort reform.
Great. Thank you, Congresswoman. We're going to go out to a question from I believe it's Eve on the phone. Eve, you wanted to ask a question to the Congresswoman?
Yes. I wanted to say that I fully support total health care reform, including a public option. I think it would be such a mistake to give that up. But what I don't understand is when somebody calls, like a woman did a few minutes ago, and says she's against socialized medicine, and she said she was an older woman, and she's against socialized medicine, and she doesn't understand the plan. I don't understand the reluctance to just point out to her that Obama's plan is not going to be any more socialized than Medicare is. She's obviously on Medicare. People like Medicare. And the public option is just going to be a form of Medicare that's extended to other people. So I don't understand why you just don't reassure them by using Medicare as an example.
You are absolutely right that people like their Medicare. And I've heard from many people in the veterans community that they like the care that they get through the Veterans Administration. The public option, however, is different from Medicare in that it is not going to be administered the same way. It is going to be an option on a health care exchange, competing with different private health care systems that would also be on the health care exchange for the dollars from the various employers or individuals that might want to join it. I think the public option is going to be a very good thing. I think Medicare is a very good thing, but they may be subtle, but there are a few differences in this. But I really appreciate your support for the public option and your support for Medicare and for helping me try to make this more understandable to everybody.
Great. Again, if those of you just joining us, we're back up over 2,800 folks on the call with us from Central Ohio. If you would like to ask the Congresswoman a question, please have your question ready. Press *3 on your keypad, and you'll be sent to one of our staffers. We'll get the question up, and we'll be able to ask it. And we'll also have another poll in a second. But first, we're going to go out to John. John, I think you have a question about will members of Congress, or excuse me, every branch of government be considered under this plan? So, John, you want to ask your question to the Congresswoman?
Yes, thank you for taking my call. My question, I hear folks in the government saying us, and you've said that this evening about what we all are dealing with. Will you and every member of every branch of government be under the exact same system that is put in place?
The way the federal government works now is that every federal employee chooses the kind of health care that they want to have on an exchange system that's going to be much like the exchange that we are building. People can shop for the kind of insurance that does the best for them. And their different copays cost a different amount of money depending on what they want. Typically, single people buy a more basic plan, and families or older people typically buy a more expensive plan. And the government pays its share of the employers. The public option, I think, is going to be a great option. I personally would have no problem going in it, but here's some of the issues with that. We want employers to keep their health care in place. We want to continue to build on the employer-provided health care system that we have in this country, and we are keeping large employers, and the federal government certainly qualifies there, out of the public option right now. It is only for people who are uninsured, people who are small businesses, and then in succeeding years it could potentially grow to include more people. But the anticipation is that the public option will serve a particular purpose.
Great, thanks, Congresswoman. I think we're going to ask just one more, trying to get to everyone's question, but there's a bunch of questions about the public option, and I want to make sure we get to at least one more of those. So, Jeff, are you on the call? Jeff, you have a question about the public option? Hey, Jeff, why don't you go ahead and ask the question?
Can you hear me?
Yes, we can, Jeff. Go.
Okay. Congresswoman Kilroy, we're so thankful that we have you, and we're very proud of the job that you're doing. My wife has 5 incurable illnesses, and she can't get health care. I lost my job recently. If she has to go to the hospital, the people who are against health care reform are going to have to pay. My question is the public option still alive? I mean, in recent days we've been hearing a lot about the White House backing out of the public option. What's going on?
Well, I think there's a lot of support for the public option among a lot of members of Congress, but not everybody. It's a complicated problem, and some people have different ideas about how to go about it. Some people have different ideas about how to contain costs. It's going to be very exciting to see what happens when we get back there in September and continue to bring people together to work on that. But I still hear support for a public option from people in leadership in the House of Representatives, and also from people in the United States Senate as well. We want to make sure that we can include more people in the healthcare system and to lower our costs. And the best way I see to do that is to have a public option and inject some competition into a system where insurance companies have big monopolies, big control over insurance markets. Cleveland Clinic, Mayo Clinic, places like that support a public option because they realize that we need to offer health coverage to so many people like yourself who are losing their coverage. And I really hope that you and your wife have some better luck and some better health. And, you know, you give such compelling reasons why we need to fight hard for real health care reform in this country.
Great. Thank you, Congresswoman. Congresswoman, we're going to grab one of our polls right now, our second poll of the night. The second poll of the night is just like the first poll. It's a different question, and you're going to press 1, 2, or 3 for your answer this time. 1, 2, or 3. The question is, how important to you is a plan supported by both Republicans and Democrats on health care reform? If you think that health care reform must have significant support from both Republicans and Democrats, please press 1. If you think health care reform must get done regardless of the support from Republicans in Congress, please press 2. If you think the health care reform should include input from both Democrats and Republicans, but a successful final vote is what really, really matters to you, please press 3. You can go ahead and press 1, 2, or 3 right now, and we're going to go out to our next question from Fernita, I believe is the person's name. Fernita, do you have a question about access to health care?
Yes, I don't understand the problem with all these people that are not eligible for health care. Medicaid is a system that puts you into health care, and they have a section for spend down for working people. And I don't understand why there's such a big thing about all these people that are uninsured. I just don't understand your mentation.
Let me try to help out with that. First, Medicaid is not open to everyone. Medicaid is typically restricted to 2 categories of people. 3. Children, women with children, and people with severe disabilities and no employment and no ability to get employment because of the nature of their disabilities. And the income levels that you have to spend down to, as you suggest, are very, very high. I mean, you cannot have assets as a everyday person and be able to qualify for Medicaid. One of the things that we want to do is to help the poor, help people with disabilities. One suggestion is to raise it from 100% of poverty to 133% of poverty. That would be able to cover single men who don't, that can't get health care. They're not covered at all by Medicaid now, not at all. We see that a lot of people that are working hard, that have jobs, that are playing by the rules, that don't have health care coverage. Their employers don't cover it because their employers can't afford to do that. They can't afford that because they don't get paid enough to buy health insurance. If you try to buy it in the private market, you get priced right out. And some people are excluded from health care coverage because they have a pre-existing condition. Pre-existing conditions are a form of discrimination that insurance companies use to keep higher-cost people out of the system. So I've had examples of people with allergies or asthma or somebody who had a mild heart attack at the age of 37 and now is in their 50s that can't get health insurance. They can't even buy it. We also find out that a lot of people don't have health care and suffer big time because we see that the bankruptcies in our community are going up and foreclosures. And one of the reasons that we learn that these things happen is because people get high health care bills that lead them into bankruptcy and foreclosure. So we know that there are a lot of people who are working, who are trying to do right by their family, and end up suffering some very devastating consequences because they can't afford health care.
Great. Thank you for your question. Congresswoman, we're going to go out to, let's just remind everyone one more time of the poll. If you think health care must have significant reform from both Republicans and Democrats in Congress, please press 1. If you think health care reform must get done regardless of a bipartisan agreement, please press 2. And if you think health care reform should include input from both Democrats and Republicans, but you truly feel that the deal is what's most important, health care reform is what's most important, please press 3. We're going to go out now to Chris Richter. And Chris, I think you have a question about Medicare and how this all works out.
Yes, thank you, Congressman, for your time this evening. Two things. One, if you can answer the statement regarding no cuts are going to be made in Medicare. Well, part of the issue is going to arrive from the $313 billion in cuts over 10 years to providers of health care. Thus, won't that cause more of a shortage of doctors and services, thus lead to the rationing situation that everybody's been talking about being fearful? The second question I'd like to ask is your position on the CAPS amendment. Thank you for your time.
I'm sorry, I didn't catch the last part of your question.
The CAPS, what
Lowest
is your
cap?
position on the CAPS amendment regarding the public paying for, taxpayers paying for abortions? The CAPS amendment.
Okay, I wasn't familiar with that one.
But I'm more worried. Yeah, you have to get back to us on that.
Okay, let me see what I can do here with the issue of cuts to providers. I think things are going to be shifted to providers. First of all, hospitals have been are going to be able to get reimbursed for the coverage that they're now providing to the uninsured. And so it'll be more direct and I think a more efficient and business-like way of paying for health care for the uninsured. And it'll be less burden on insurance carriers and less burden on the taxpayers there. I think that when we're talking about some of the cuts, we're also talking about getting a better deal from the pharmaceutical industry. Some of the biggest areas of inflation in health care have been in pharmaceuticals. I believe, although I'm not sure that the Congressional Budget Office knows how to score this, that we will be able to obtain savings in health care by putting a greater emphasis on prevention and dealing with issues of chronic care, which is the most expensive area of health care, those of us with chronic illnesses. And we can help people avoid getting them. We can help people live better with them and therefore lower the cost of the system as well. It's a difficult issue, and I'm sure that this is not going to be the first time that we're going to be taking a look at this. It'll probably be something we're going to have to continue to work on over a period of years. But we want to make sure that we do the best for the American people and for our budget. One of the big things that that I do believe in is that with greater emphasis on prevention and primary care, we will have those savings. With greater attention paid to preventable hospital-based infections, we can get more savings. With getting into health information technology over a period of years and eliminating unnecessary testing, we can get more savings. And there's a number of other things in the bill where I think we can achieve that. I think we could also eliminate some of the money that are going to the private Medicare plans that have been overcharging and costing us too much money. The bill also has strong sections that will go after fraud on Medicare and Medicaid payment to make sure that we can address the issue of the abuse of the system as well.
Great, thanks, Congresswoman. We're going to go to another question about Medicare. I think, let's see, where is it here? Bell is the person's name, and Bell has a question about the so-called donut hole in Medicare Part D. Bell, are you with us?
Yes.
Great, Bell. Go ahead and ask your question.
Good evening, Congresswoman. I'm on Medicare, and there's a huge donut hole in between what is covered until you reach catastrophic coverage, and I was wondering if there's a part of this legislation that will close that donut hole. I know for myself I was prescribed a medication that cost $3,000. Also, is there any way that we can get the drug companies to lower the prices of their medications? I know that in Canada they're so much cheaper up there, and if they're making a profit in Canada, why can't they lower the prices here to match the prices in Canada? And I know that it's a, is there any way that the law can be changed to allow people to go to Canada to get their medications?
I think you make a lot of good points. And, well, I would not be against changing the law to let you go to Canada to get your medications. I would prefer to see a system where you could afford your medications in this country. And one of the things that we want to do is close that donut hole. $500 would be how much it would be closed the first year. Now, the donut hole for many seniors is more than that. So each succeeding year, we would close it down more. And where we want to make those gains is in negotiating prices with those drug companies to get the best deal for seniors. I think that some other things that seniors will get from this bill would be the elimination of co-pays for primary care visits. We want to make sure that those co-pays are eliminated so you can get the preventive care that you need. So we'll make sure that we are strengthening Medicare and taking care of our seniors, as well as addressing the issue of the high cost of health care for all of us and the many people who are excluded from the health care system, either because of finances or pre-existing conditions.
Great. Thank you, Congresswoman. I just want to give the results of the polls. Our last poll that we had, Congresswoman, we actually had how important is to you that a plan is supported by both Republicans and Democrats in healthcare reform? Over 40% agreed with number one, which was healthcare reform must have significant support from both Republicans and Democrats. About 29% agreed with healthcare reform must get done regardless of support from Republicans in Congress. And about 31% said healthcare reform has to be the priority, but there should be at least some input from both sides. So that's a good poll, and we'll ask our final poll in a couple of minutes. But now I know, Congresswoman, you do these because a lot of times you want to clear up misconceptions up there, and I think Wilma has a good question about rationing care. Wilma, are you out there?
Yes, I am.
Hello. What's your question? Good evening, Wilma.
Yes. What I want to know is, with this plan that you have, with all of these people, receiving this medical care and everything, it's going to be more work for the doctors, and it's going to be rationed. Now, who decides who gets the care and who doesn't? Will it be the senior citizens or the handicapped? Will they be cut? And I add one to they say that I love my private insurance. It's the best.
Well, good. I'm glad you like your insurance, and I let me tell you, I would be so opposed to eliminating or rationing health care for handicapped people or for seniors. That is not something that's going to happen under this bill. We want to make sure that we are expanding access to health care. Now, you're saying that there's going to be this shortage of doctors to provide the primary care. But I think a couple of things could change that. First of all, primary care providers will be encouraged to stay in primary care because they can have an affordable business model. They'll get reimbursed. They'll have timely payments. We are hoping to have a universal health insurance claim form, so they won't have to be filling out 40 different kind of forms for various programs to help streamline their costs. And we'll also be able to get more people going into primary care because we'll help them with loans and grants and their student expenses. Also, we'll encourage advanced practice nurses and other health care professionals to become part of the primary care provider network. It doesn't always have to be a physician. I could sit down with a nurse and talk about my condition. For example, I know nurses who do very good education with diabetics or with asthmatics to help them learn how to manage their chronic illness. And they're a critical element of the primary care network. There's a lot of ways that we can do this. We're not talking about rationing. We want to make sure that seniors keep the health care that they have and the access to health care for seniors and all of us will be increased.
Great. Thanks, Congresswoman. We're now going to go to a question from Tom. Tom's been waiting a little while, so I want to make sure we get to him. Tom has a question about employers and employees for the reform. Tom, are you with us?
Yes, I am. I want to thank you for doing this town hall meeting, and I'm using the phone as a great way to get everyone involved and spread democracy. I really like that. I am an employee benefits broker here in Central Ohio, have been for 25 years, and when I go to advise my clients on how to help cover their employees, we certainly have to deal with issues of pre-existing conditions and market access. However, I think one of my concerns about a government plan is if I go to a client, one of my clients, he will simply say, I'm not doing health insurance anymore. Go get it yourself through the government option. And kind of flies in the face of what's been reported is that you get to keep that insurance because the employee really doesn't get to decide their insurance, their employer does. And the other thing, I guess the heart of the matter is employers, being smart business people, if you have a 20-hour work requirement to be eligible for benefits, they'll probably put their people on part-time work and they'll work 19 hours or make them independent contractors, and you've really not solved the problem. You've just caused a dislocation. So I'm concerned about that. So I guess I'd like your comments on that.
There's a lot there. First of all, small businesses will get help with their health care bills, those that are eligible for it. Some 13,000 we're anticipating that pay for their health care plans will get help in the form of subsidies to make sure that they get their employees into the system. If they don't, on the other hand, they're going to pay a penalty. So we want to make sure that people keep their health care and don't drop it. There are a lot of benefits for the employer for having insured employees. Not a more competitive and healthier workforce. So I think that the subsidies and the incentives for businesses, small businesses, to keep the health insurance will be a big benefit to them.
Great. Thanks, Tom.
I might
hope
have
that
missed
answered.
some of the questions because there were a number of them there. I think there are also
Tom
tax
left us,
cuts, too. So.
Yeah, Tom left us, so we're going to try to move on, Congressman, and try to get to as many of these questions as possible. The next question we're going to go to is from Michael. Michael wants to know about a little more process, and I think I'll let him ask you a question. Here you go. Michael, are you with us?
I am.
Great. Why don't you ask the Congressman a question?
Yes. You keep referring to the bill, and I'm curious as to exactly what version of the bill we're talking about this time, and if you've even had a chance to take a look at it. I know one version that I was able to read a little bit about had a provision in there that if you have private health insurance at this point, and if it were to lapse or you were to leave that plan, that you're not able to re-enter the private sector but must go into the government-sponsored plan. I do know that was in one version of the bill. Is that still in this version?
Well, it is not in House Bill 3200, and I'm so glad you clarified that for us. There is not just one bill. There are 3 bills right now. One is the House bill, and there are 2 bills in the Senate. One is coming out of the Senate Finance Committee, and one is coming out of the Education Committee that Senator Kennedy and now Senator Dodd are chairing. So there are 3 different bills. For the most part, I'm talking about the House bill, and it's the House bill that I've been working on as a member of a House. I'm not a member of those committees of jurisdiction, but I spend a lot of time reading the bill, debating the bill in our caucus, discussing the bill with my staff, and anybody that wants to read it for themselves can see it on my website. There's the bill. There are also section-by-section summaries of the bill, so you can see which part of the bill you might be more interested in. The bill's long, but contains sections on the public option. It contains sections on the help that's available for small businesses and others. It has a section on the public health infrastructure, making sure that we have vaccines for kids and seniors, flu shots, addressing those issues. We have a couple sections on addressing the issue of fraud and abuse, sections on Medicare and Medicaid, and how those will be addressed in the bill as well. And I think if you read those, people that are concerned about Medicare will have more assurances that their Medicare is going to be there and stay the same, that they will still be getting the kind of coverage that they have now and then some, that they'll have better co-pays, close that donut hole, and I think you'll see the ways that we help encourage more primary care and more primary care providers.
Well, in this bill, then, in the House bill versions you're discussing, is that true or not true? That if I leave the private sector, I cannot re-enter it? It must go to the public government-sponsored plan?
No, that's not true. No.
That's just not in this version.
No, that's not true.
I think the hardest thing with trying to hold these town meetings and discuss this bill is no one knows exactly what we're talking about. The final version may be entirely different than what we're talking about tonight. So I think it's very difficult to push or encourage people to be receptive to this bill when we don't know what we're talking about yet. I mean, I know there's lots of ideas out there, but it seems to me there's a broad range of ideas out there that nothing's been laid down yet strongly to say, here's what we're going to throw out to the people. Let's see if they'll accept it.
Well, it's a little more concrete than a lot of ideas. There is a bill that has been drafted and that is passed out of 3 committees. Each of those committees added some amendments to the bill. Those amendments are also available online. And there's also, of course, some differences with the Senate versions. And that's going to have to be brought together. So in a sense, you're correct that we don't know all the answers right now. But that's why we took this month of August to come back into the district, to continue to talk to people, to try to hear what's on people's minds, what they're concerned about with the bill. And then we need to go back to Congress, and each of us need to do the best to represent our district, to get the best health care plan that we can, and continue to get the facts out about this bill and about any changes that may come in this bill. But I encourage people to let me know, to let our senators know what you want to see in a health care bill. I think it's very important that we engage in this kind of advocacy and make your views known to your representative.
Great. Thanks, Congresswoman. We're going to go out to a question from Bob next about private companies versus the public option. But first, I want to make sure we get our last poll in. So quickly, the last question is, how has your support or opposition to health care reform changed since January? So since the Congress just started, would you say that you strongly agreed with health care reform but now have significant concerns? Press 1. Would you say you strongly agreed with health care reform and still think it's a top priority Congress should address in the coming months? And number 3, would you say that you strongly disagreed with it the whole time and continue to believe that it is unnecessary? So it's 1, 2, or 3, and we're going to try to get as many questions in as possible. So Congresswoman, if this is the lightning round, we're going to try to go quickly. And we're going to go to Bob. Bob, do you have a question about the public-private option?
Yes, I did. The private insurance companies have to make a profit. And so my question would be is how can they compete with an entity, the government, that does not have to make a profit and can just print money? Or you could take the President Obama example and say FedEx can compete with the post office because the post office is so incompetent. So is it the government option will be so incompetent the private insurance companies will still exist, or they will be competent and private insurance companies cannot exist, or is there a third way?
I'm not agreeing with some of your premises there, but first let me say that the public option is going to have to be self-sustaining. It's not going to be subsidized. Its administrative costs, et cetera, it's going to have to get from the premiums that people pay. Now, individuals might be subsidized, but they could take that subsidy to a private plan just as much as they can to a public plan. The Congressional Budget Office estimates that private insurance will survive quite well. that it'll be 2/3 private and 1/3 public. And interestingly, this is one of the same arguments that was made 40 years ago when Medicare was passed. But it seems with Medicare that the private insurance companies are doing quite well.
Great. Thanks, Congresswoman. We're going to go quickly to Mary. Mary has a question about obtaining savings through personal choices, healthier lifestyles. Mary, do you have a question?
Yes, Congresswoman. First of all, I appreciate how much you've made my future health better through air quality improvements and food safety. But when we look at health care reform, I think you touched upon it earlier. Because the Congressional Budget Office cannot score cost savings from people being healthier instead of being obese, for example, or instead of abusing substances, engaging in distracted driving, whatever actuaries might think contribute to higher medical costs, it seems like I've heard just too little about how we're going to cut medical costs in America by cutting these epidemic obesity and other problems that we have.
What we want to do is put a focus on wellness and prevention. We could take one disease, for example, like diabetes. Now, there's an epidemic of that in Franklin County. It costs a lot to the employers with days off of work. It costs a lot to the individual with diabetes with the devastating consequences of that disease. But if we could help people control their diabetes, to have the test strips, to have the medication that they need to keep it under control, and to have the counseling and primary care to keep it under control, that is one way we could really lower costs. Because uncontrolled diabetes could lead to blindness, it can lead to high blood pressure, it could lead to kidney failure, it could lead to amputations, it could lead to silent heart disease. So that's just one way how primary care and counseling and getting people access to primary care and the medicine and the supplies they need will help them and help the system. It could also help them get smoking cessation programs. So a lot of ways that we can do that.
Great. Congresswoman, we have time for literally one last question very quickly. So, Bill, if you could ask your question very, very quickly, and Congresswoman, you could answer it, we'll be going. Bill, go.
Yeah, okay. Congresswoman, the federal debt is currently at about $11.5 trillion and growing. The President has indicated that he thinks that is an unsustainable level of debt. The question is, do you agree? And if so, how can you possibly vote for health care reform, which the CBO has scored at more than $1 trillion over 10 years and has indicated that it will, in fact, add to the deficits?
First of all, CBO needs to score the bill that's written and the bill that's finally written, and they haven't done that yet. Those numbers, that $11.5 trillion the number that they put out there earlier is not the score of either of the particular House bill. So that's one. Secondly, I voted for pay-as-you-go legislation, and I think that's very important that we work to get our deficits under control. Pay-as-you-go means just that. If we want to add a program, we're going to have to find a way to pay for it, or we're going to have to cut something from somewhere else. And that's what we're trying to do with this. Our new budget that we passed, by the way, this past year, would cut the debt in half in the next 3 years in order with different cost savings that were in there. And we are budgeting in a transparent manner. We're putting everything on the books, unlike the previous administration that had a lot of off-books funding for the war, and we're stopping that practice. So we want to have open and honest and transparent budgeting. We're going to have pay-as-you-go legislation. We're going to continue to work to stop the deficit. But I think to do that, we need a more productive America. We need more people working. I think this current healthcare system is a drag on our economy. It's a drag on our employers. I think it is a necessary component of improving our economy as well as improving our health. The current health care insurance system is simply unsustainable. It's going to continue to cost us. It's going to cost our families. It's going to cost our employers. And we need to change that.
Great. Thank you, Congresswoman. Thank you for joining us, everybody. This call is now over because we've allotted our time. But I just wanted, Congresswoman, everyone to know that if you haven't asked a question, please stay on the line and you'll be sent to our voicemail, and you'll be able to ask your question there, and we will certainly get you a response in the mail fairly quickly. Congresswoman, you had about 2,900 people on the call at one time all night, and I think it was a great call.
I appreciate everybody spending the time with us. Thank you.
Thanks, everybody. Have a great night.